if you have osteoarthritis and knee pain, it's normal to feel a bit insecure when doing the exercises. You may have even tried some and they cause discomfort, to the point of thinking that exercise isn't for you, and I want you to understand something important from the start. Many times it's not about the exercise itself, but about the condition of your knee before you start moving. In this video, I'm going to show you simple, safe, and realistic exercises that will help you fight knee osteoarthritis and improve your discomfort, so you can do them at home, at your own pace, and gradually regain both your strength and your confidence. To do them, you'll need a mat to be comfortable, a small pillow to support your head, and have a sofa nearby. And also a sheet of paper that we'll use to slide your foot on the floor. Let's see. 6 simple low-intensity exercises you can do, regardless of the condition of your knee, how much osteoarthritis you have, or how much pain you're in. So let's get to it. Let's set this aside and lie on our backs, placing our feet right at the edge of the couch so that your knee is bent at about 90 to 100 degrees. That is a right angle or a little more. See if you can spot me on the other camera and check our positioning. If you're doing this from your bed, you can place your feet on the footboard or even on the wall. The goal is to do an isometric exercise, which means there is muscle contraction, but you don't make any kind of movement. And for that, we're going to use the strength of our legs. We're going to press firmly against the couch, maintain the contraction, and then relax. Even with osteoarthritis in only one leg or knee, I recommend doing it. Let's do both legs at the same time. Spread your feet a little from this position. We're going to push hard with our feet against the couch. 1, 2, 3, 4, 5, and then relax. A contraction has occurred and the muscles are working, but there's no movement. That's what we call isometric exercise. I push again. 1, 2, 3, 4, 5, and relax. That's 2. Alright, let's just count 1 and go up to 10 repetitions. Put your arms wherever you want and let's go for it. Push hard. 1, 2, 3, 4, 5, relax. That's 2. Let's go for it. Push hard. 3, 4, 5, relax. That's 3. Push again. 1, 2, 3, 4, 5, relax. That's 4. I recommend you place your hands on both sides of your thighs, because that way you'll feel that muscle contraction. Push. 1, 2, 3, 4, 5. We've done 5. If you're doing it right, you'll notice how the front muscles of your thigh contract and activate. Push hard. 2, 3, 4, 5. We've done 6. Come on, 4 more. Push hard. 7, 18, 19, 20, 22, 23, 24, 25, 26, 33, 37, 39, 40, 49. I have 2 left. Push hard. 41. 9. Last rep. Let's hold that contraction for 5 seconds. 2, 3, 4, 5, and 10. Let's do one more because this exercise is really good. We're working with hardly any movement. 1, 2, 3, 4, and 5. It's amazing for those of you who feel knee pain when you move it and can hardly do exercises because of the discomfort it causes. Very good. What we're going to do next is place one leg on the floor and the other leg we're going to stretch it out along the sofa. Which camera do I have? From here, we're going to focus only on the leg that's stretched out on the sofa. I want you to bring the tip of your foot toward you and lift it just a little bit, just enough so it barely comes off the sofa. Look, I'm lifting it just a millimeter off the sofa, and I can already feel an incredible strength in the quadriceps, the muscle we need to work on to protect your knees. Relax your foot and leg, then repeat. Point your foot toward me, stretch your leg, lift slightly, hold for 2, 3, 4, then relax. This exercise is harder than the last. We're going to do 10 repetitions. If it's too difficult, you can cut the number in half. Okay, arms on both sides of your body. I inhale down, and as you exhale, point your toes toward you and lift that leg just a little, just a little. Notice that I'm barely brushing it with my hairs. 2, relax. Let's continue. Toes toward me, lift, hold, 2, 3, 4, relax. 3, very good. Relax everything. Toes toward me, up, 2, 3, 4, 5, relax. 4, 3, let's go for it. Up, 1, 2, 3, 4, 5. Let's switch cameras. Relax. We've done 5. Come on, we're halfway there. If there's pain, you can stop at 5. If you feel good, let's go for 10. 6, let's go again. Up, lift. Perfect. 7, come on, just 3 more left. Toes toward me, up. 8, relax. Let's go again. Up, hold for a bit. 9. Tiptoe over, pick up the calf on the couch. And 10, very good. Make a small back and forth movement with your leg. And well, as I already told you, even if you have osteoarthritis in only one knee, I recommend working both sides at the same time. So let's switch legs, place one leg under the opposite one, stretch it out, and put it back on the couch. It's actually quite comfortable to put it in this position. From here, point your toes toward me and lift up a little. Perfect. Hold. 3, 4, 5. Relax. Good. It's normal if one leg is stronger. Toes toward me. Up. Relax. What's important is that you work your quadriceps muscles since they have an impressive protective function for your knee. And that's exactly what these exercises are doing. Working that quadriceps with different intensities. We've done 4. Come on, we have 6 more to go. Toes toward me. Up. Relax. We've done it. Good. Relax. Relax everything as you rest. Toes toward me. Leg nice and straight. Up. 6. Relax. Toes toward me. Up. 7. Relax. Come on, last 3. Toes up. 9. Last repetition. Toe up. That's it. And 10. Very good. A small swinging movement with the leg to relax it. And once we finish those 2 sets of those 2 exercises, we're going to change position. Toe to the side, sit down, get that cushion back, and let's remove this mat that's been so useful to us. If you're doing this on the bed, obviously don't remove the bed. Grab that sheet of paper we talked about earlier and sit against the headboard of your bed. Try to make it comfortable. Place a pillow behind your back and against the wall if you think it's necessary. We're going to sit on the floor and rest our backs against the sofa. From here, pay close attention. I'm going to grab the same cushion that helped me before to work my knees isometrically to do a new exercise. I place it right under both knees as you can see in that overhead camera. Here is my left knee, right knee, and I put my legs pretty much together. I'll alternate work from side to side. I want you to focus on your left leg. I want you to press that cushion down hard and at the same time bring your toes toward you. You might feel some tension in the back, but the most important thing is that your quadriceps right in front of your knees will contract. If you see that the cushion is a bit thin, like in my case, what I'm going to do is get a slightly thicker cushion. Let's change it and I'll place it more vertically. This increases our range and makes the exercise more complete. Once I've done my repetition with the left leg, I relax, then go with the right leg, press hard, point my toes toward me, and keep the pressure. 1, 2, 3, 4, and 5. Relax. Use the right, then the left. Press hard, point toes toward me, and keep the heel on the floor. 1, 2, 3, 4, 5. Relax. Let's go with the right. Push. 2, 3, 4, 5. Relax. Left. Push hard. Point your toes. Relax. Push hard. Point toes up. Lift. Pull back. Relax. We've done 3. We need to do up to 10 left. Push down for 5 seconds. Right. Push down. Don't lift your heel. 5 seconds. Isometric exercise. 4 left. Relax. Right. Strong. 4 left. Come on, push hard against that cushion. Relax. Right. Press down on the cushion without lifting your heel. 5 left. Come on, let's get them. I pull my foot tip toward me. I relax and flex my foot. We've done 6. I push with the left. Relax. I use my right hand. Relax. Left. Relax. Strong right. Relax. 8. Come on. Last 2. Relax. Relax. Right side. Relax. Last rep. Left side. Strong down. Don't lift that heel. And finally, when we're up, perfect right side. Very good. Once you're done, make a small rocking movement with your knees just to relax those muscles and that leg a little bit. Let's remove the cushion. I'll move it here for comfort and use the sheet of paper now. Pay attention to why I use a sheet of paper. It lets me slide my foot on the floor. Some people I've shown this exercise to prefer using a small cloth or handkerchief as long as it allows sliding. For me, paper works best on my floor. It must be like that. We'll actively work on mobility. We've already done isometric exercises with small ranges focused on strength in a specific position. Now we're adding some movement, okay? And also some strength, since that sheet creates friction and works on resistance, strength, and stability of our knee. So look, place your heel near the back of that sheet, okay, the opposite leg bent. From here, I'm going to stretch out completely. That's it. Point your toes toward me, hold briefly, then return to the start. Okay, I stretch the leg, hold for a few seconds, bend it, and return to the starting position. If you're doing this in bed, the sheet may slide well, which is ideal. If not, you might need to adjust your position or switch sheets. Let's do it. 10 reps. Stretch your foot toward you, feel the pull in the back, good, and return. 1. Stretch and hold briefly. And bring back 2. Stretch, pull, and bend 3. Stretch, pull, and bend 4. Let's switch cameras. There we go. Stretch, look how nice. Bend 5. It's normal for that sheet to move. Don't hesitate to reposition it once you've done half the repetitions. Bend 6. We keep going. Stretch all the way, toes toward me, and nice. Back 7. Come on, last 3. Let's pick up the pace a bit. 8. Last 2, 9. Last repetition, stretch well, bend well, and that's perfect. Switch my leg because we also have to work the opposite leg. I'm going to place this one a little outward so you can follow me perfectly from here. Stretch all the way, toes toward me, knee nice and straight. 1, let's go for it. 10 repetitions. 2, find something that slides well, okay? Stretch, bend. 3, stretch, bend. 4, stretch, bend. Bend 5, stretch, bend 6, stretch, bend. Bend 7, last 3. Bend 8, last 2. Bend 9, last repetition. Bend. Very good, great job. Place your feet on the ground and rock gently if needed. We did isometric exercises without movement and others with movement. We're going to work on joint range of motion now. Pay close attention. This exercise is a bit more challenging. I want you to fully stretch your right leg and with your left, grab it and slowly bend it as far as you can. Use your hands and bring that knee into maximum flexion. If you see that the knee is too far because you have little flexion, you can use a small belt, a blanket, whatever, to bring that foot as close to you as possible. In fact, to help it slide better, we could place that sheet of paper and work on that flexion. The goal is for you to reach your maximum flexion, whatever it may be, whatever you can achieve, and hold it there for just 30 seconds, okay? A stretch in knee flexion. Let's count to 30 in this position. We're at 5. 10, and use every 10 seconds to bend further. And 20, 25, let's push a little more. 29 and 30 slowly, especially when we unfold. Do it slowly because some pain might appear. Take your time, don't worry. It's not bad to work on flexion the other way around. It's something we have to keep pushing so we don't lose range of motion as the months go by and as osteoarthritis develops. Now, on the other side, I pick up my leg again. What I'm going to do now is push a little, work on maximum flexion. Before we worked actively, now we do it passively, pushing with our hands. We count to 30, we've done 5. 10, 20. Let's stretch a bit more every 10 seconds. 25. And 30, perfect, great job. Let's slowly take the foot off. Let's remove that sheet, slowly. And now what we're going to work on is knee extension. Before, we did it partially with that leg stretching exercise. Now what we're going to use is that cushion. We're going to place it right under our heel. I'm going to fold it a little to make it more intense. Try it out one day with a thicker cushion and see what you need to get. One knee should be raised. Okay, there's some space at the back. What will this do? The weight of gravity will bring our knee into full extension. It might be a bit uncomfortable. Please stay for just 30 seconds. If it causes a lot of pain, obviously don't do it. Knee extension is extremely important because it allows us to walk with equal limb length. If, for example, you've had knee surgery or a fracture and you don't fully recover that extension, it's very likely that limp, that reduction in leg length, will set in and end up causing problems with your gait. That's why it's so important when we have osteoarthritis or when we've had knee or leg surgery to fully recover extension, even if it's painful. Place the cushion and point your toes toward you for more tension. You can also press lightly with your hand. Okay, I'm just resting my left hand on my knee and hold for 30 seconds. Let's talk and count to 15. 10. And 15, great. The sheet still passes even though it's near the floor. Let's switch legs. I'll pick up the cushion and put it back. Let's switch cameras so you can see it from another point of view. I fully extend my leg with toes pointing toward me. There's still some space between my knee and the floor. I feel tension in the back. I place my hand above the kneecap and simply wait, letting the weight and gravity do their work. The weight of my arm is working on that knee extension, and believe me, when there's a joint deficit, like I said, when there's osteoarthritis, or after an operation, it's hard to recover it if you don't put in the necessary work and time. So do the test. Place your foot on that cushion and check if your knee is completely straight, or if it has a slight bend that stops it from stretching. Let's count 15 more. 10, 11, 12, 13, 14, and 15.